Hi, everyone, and welcome to the Muslim Sex Podcast. I have some exciting news. I want to let all of you know that I am opening up my office, my private office, where I can see you here in New York, and it will be opening at the end of this month. So this month is now June. So at the end of this month, my office will be up and running, and I would love for you to come in and see me as a patient. So go to V Health, so that is FEMMEVIEHEALTH.com, and sign up to be a member of my concierge gynecology practice. And you can also come to see me for regular visits, or if you have a problem visit, come and see me. I, of course, focus on menopause and sexual health. So if you're having any of those issues, I'd love to see you. And make sure you come in and say hi. I'd love to meet you in person. So also, the retreat is still going on. It'll be happening September 16th through the 23rd, and we only have a few spots left. So if you were thinking about coming to the retreat where we focus on nutrition and sexual health and menopausal health, you need to register today because spots are filling up. And once it's sold out, it will be sold out and we will not be taking any more participants. So make sure you go and register for that as well. Also, as always, please remember to like and share this podcast. Leave me a 5-star review so that it shows up and so that we can get the word out about menopausal and sexual health, as well as intimacy and intimacy coaching. So if you love this podcast, please make sure to leave me a 5-star review. And now on to the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast, and I'm your host, Dr. Sadaf Lodi. So I am going to be doing a series on revitalizing the spark in your relationship. And these few podcasts are going to be just me. So it's going to be yours truly. And if you attended one of my webinars, you may hear similar content, but you know what? It was too good not to share it with everyone else. So I am super excited to bring it to those that may not have been there and can also gain some value from it. So really excited to bring it to you on my podcast. And the first thing I want to get into, as I do with every episode, is that, of course, I'm not giving any type of medical advice. And in this episode, it's really not going to be any type of medical advice. It's really more of my coaching, my intimacy coaching that I do. So you'll get a little sample of that. And of course, this is not any type of religious content. So, as always, if you have any questions about your religion, please speak with your friendly neighborhood religious leader. So this is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. And in this episode, it's going to be a lot about relationships and how to revitalize your relationship, and you're feeling kind of stuck in your relationship, you're not really sure what to do. This may be an episode that you come back to over and over again. Maybe you tag it, maybe you share it with a friend of yours that is feeling stuck in their relationship. So it's going to be a great episode and I want you to take a listen. So here we go. So of course, as you all know, I'm Dr. Sadaf and I have been doing intimacy coaching now for a couple of years. And of course, as you know, I'm a board certified OBGYN and life coach, and actually I'm a sex counselor as well. And I've been practicing in New York for about in New York itself, about 20 years, but total overall experience is over 24 years in obstetrics and gynecology and helping women with their physical issues and, delivering babies and all this stuff. And I earned my certification for my online one-on-one coaching through Rutgers University, and which of course laid my foundation for my intimacy coaching that I do. So just a little bit about kind of my story and how I kind of got into this whole realm is that, I grew up in a traditional first generation home where we definitely didn't discuss anything about sexuality. And I think that is probably common for a lot of people. I don't think just for first generation individuals, but I think in general, I think a lot of people may not have grown up talking about sexuality in their homes. And of course, being that my parents were new, I never attended sex ed. So, they weren't sure what that was. And so when everybody else went away into, the boys went in one room, the girls went in one room to learn about sex education, I actually just kind of sat outside in the playground by myself. So, I never got that education either. So, really whatever I learned at that time was, I don't know, through my siblings, or it was through like romance novels or something like that. And thank God I know better now than I did back then. But, as you're growing up, you're really not sure about what's true, what's not. And then fast forward to medical school and residency, I thought definitely it was time that I sought out more information on my own, right? Because even in, like, honestly, even in medical school, we don't get very much information on sexual education or menopause or anything like that. And then even in residency, I didn't get anything at all. So, really, my whole journey of learning more about sex education and becoming a sex counselor has really, just kind of been me investing in myself and learning about these topics so that I could share them with you. So, of course, I understand the importance of exploring ideas and beliefs about sexuality and, what people feel that it should be. Sometimes we grow up with a lot of sex negativity. And so we go through our whole life with that. And you may not even realize that you have that, right? Other times there are people that realize that they grew up with sex negativity and then decide for themselves that they want to change and they want to become a little bit more positive, not only for themselves, but also for their children. So that's kind of where I was. I definitely want to encourage more communication about this taboo subject and help you create happy, healthy, sexually fulfilling relationships. So, if you're lacking desire and find your marriage to be lacking desire, passion, or love, then you're definitely listening to the right episode because we're going to be talking all about that in this episode of the Muslim Sex Podcast. So, let's dive in and show you how you can reignite the spark in your relationship. So the first thing we have to understand is, generally how as humans we think, right? So if I were to ask you, if you were sitting with me and we were coaching and things like that, I would ask you what you think is the biggest sexual organ. And then I'd give you a little moment to think about it. And if you answered the brain, you're absolutely right, because that's really where everything starts, right? For us, in terms of relationships, in terms of what we're thinking, and how our thoughts are then manifesting into our actions. Let's explore now how our thoughts and our brain function influence our understanding of intimacy. Now, the brain, as we just talked about, is our biggest sexual organ. Now, what I mean by that is that when we examine, for example, let's say the male brain and how it relates or sees sexuality, it's often in terms of fears related to performance and consequences of or fear of performance failure, like maybe not having an orgasm or unable to have an erection, right? Or even premature ejaculation. Men often focus less on non erotic thoughts during sexual stimuli because their concerns are more about performance. On the other hand, if we're looking at, say, like females and the female brain, those issues tend to revolve a lot on body image and its connection to intimacy. And I have a whole episode that I'm going to record on the importance of intimacy and body image and how that affects and how those two are definitely connected. But it's important to note that women can sometimes tend to have higher inhibitions, which show up as worries about the relationship or concerns about sexual function, and an emphasis on things needing to be perfect for arousal to occur. So, for example, for a lot of women, we get distracted with all the things that we have going on in our lives, right? And sometimes, not just women, but I think, sometimes individuals can be caught up in overwhelm, right? And so a coach that I know. She is actually my coach. And, she talks about how when we feel overwhelmed, we should give ourselves maximum 5 minutes to feel it. So it's okay, go ahead, feel your feelings, feel overwhelmed, all that stuff. But then don't let yourself wallow in it, right? Go ahead and then start writing down all the things that are important and then start taking action. And that's what's going to prevent that overwhelm from becoming worse. And I think for women, a lot of times, there was a study that was done that talked about how there is really women tend to take on more chores. There is the imbalance in household chores, right? So a lot of times women end up just, I guess, by default, right? Or just of what our thoughts of what women should take care of and what men should take care of, this and that. Women tend to be burdened with a lot of household chores. And so if you have so many things that you're thinking about, so imagine that, you're a woman that is going to work and then you're coming home, you're taking care of the house, the laundry, all this stuff, right? And then you have your kids and blah, blah. I mean, there's so many things, right? The list goes on and on. And so then if you're thinking about intimacy or if your partner is thinking about intimacy, that's just another thing added on to your list of chores that you need to get done. And it's unlikely that you're going to feel that you want to be intimate because of, just that you have, it's just another list, right? It's another thing on your list of things to do. And when anything is seen as a chore, we're definitely not going to want to do it. So I think that a lot of times, the uneven distribution of household chores often leads to sex being one of them. And then, women not being interested in it because they already have a gazillion things going on in their lives that's just one more thing that they have to take care of, which is not going to be something that they're interested in if they're taking care of everything else, right? It's also important to realize that our sexual response is controlled by what's called the dual control method in our brain that either gets activated or is suppressed. So it's like an interplay between things that will turn on the sexual excitation system, or in contrast, things that might turn it off. For example, maybe something that you see or hear or smell or touch, right, that turns it on, and vice versa. Maybe something that you see or hear or smell or taste or touch that turns it off. So it's like a kid's seesaw. So if you have too many things that are in your head that you see or in your environment that are stimulating, then it will turn on the sexual response cycle. But on the other hand, if there are potential threats or things in your surrounding that you see as inhibiting that sexual response, then your body's going to be turned off, right? So those are important things to remember. And actually, there's a book by Emily Nagoski called Come As You Are. And I often reference that book, but she spends a lot of time in her book explaining kind of that seesaw that I'm talking about, the dual control method. And so I think what's also important to understand is that, for a long time, what we knew about the sexual response cycle was from the 1960s, from Masters and Johnson, and then it was modified by somebody by the last name of Kaplan. And Kaplan introduced desire in this whole sexual response cycle, but really it was Masters and Johnson and they were a husband and wife team that conducted research. And it was they that came up with the idea that in this whole sexual response cycle, you have excitation, you have plateau, you have orgasm, and then resolution. And then, when this person, Kaplan, who was another man, came along, he decided to add desire and arousal in that whole sexual response cycle. And what's interesting is that it's, for them, it was kind of like a linear model, meaning like one thing happened, then another thing happened, then another thing, it was almost like one thing had to occur before the other could occur. And that was just the order that they said. And that was actually what we were taught in medical school, is that this is the way the sexual response happens. Later on, I'll go ahead and I'll talk about the female sexual response cycle. And actually, let me just mention it here since we're already talking about it. But the female sexual response cycle, what we found out, and it wasn't even until 2001 when a researcher in British Columbia, her name is Rosemary Basson, and she is a reproductive psychiatrist, I believe, and I'm trying to actually get her onto my podcast. But she came up with what we call the circular model, and it's what she calls is the female sexual response. So perhaps what we learned earlier through Masters and Johnson only was meant for men, right? And so then she said, well, women are not men, so women have a different sexual response. And so what she described in her model was a circular model. And what she states is that sexual stimuli, right? So sexual stimuli goes onto sexual arousal, but what happens is that, so it's this whole big circle, okay, what we have. And what she states is that you can actually have desire and arousal happen. It doesn't have to, one doesn't have to come before the other. And in fact, it can come at the same time. But a person has to be ready to be responsive to it. Okay. So, how does a person become ready to be responsive to it? Well, what she noted is that in relationships, oftentimes we need emotional intimacy. And, I'll go in and I'll talk a little bit more about what emotional intimacy is. But what she noted through her research was that women tended to be more responsive to sexual stimuli if they were emotionally connected to their partners. And so then, if they felt that connection, then they were more responsive to a sexual stimuli, which then led to arousal and desire. And this is often referred to as responsive desire. Now, this desire can be affected by multiple things, and that's where this biopsychosocial model comes in. Sometimes a person may not be able to respond to sexual stimuli if they're having issues, let's say anatomical issues. For example, they're experiencing vulvodynia or they're experiencing vaginismus. So vulvodynia is basically pain in the vulva. Vestibulodynia is the part of the vulva called the vestibule, which is the entrance into the vagina. And sometimes patients can have pain in that area, and that's called vestibulodynia. And so if you're experiencing, say, vulvodynia or vestibulodynia, then you may not be receptive to any type of sexual stimuli. And of course, there are patients that suffer from vaginismus. And, I've talked about vaginismus quite a few times, but, as you may remember, vaginismus is where you have basically contraction of those muscles in the lower third of the vagina. So those muscles tighten up. And so it makes it impossible for any type of penetration, whether it's through, having just a pelvic exam or inserting a tampon or any type of, just really any type of penetration. Those muscles tighten up. And so oftentimes you'll hear patients, and I had one in the clinic, come and talk about how she felt like it was almost when her partner tried to have intercourse with her, it almost felt like a brick wall. Like he just, she was not able to tolerate any type of penetration, and he was not able to do anything because of those muscles becoming so tight. And we'll go a little bit into why that happens. But of course, as you know, because the brain is the biggest sexual organ, that fear, that anticipation of fear during penetration is what causes those muscles to kind of almost like spasm. They become so tight and they don't allow any type of penetration. So there's a lot of that mind-body connection that happens with vaginismus. So let's go back to what we were talking about, which was that female sexual response cycle. And like I was saying, is that you have to be ready to be responsive to a sexual stimuli. So some things that can affect it are anatomical. So we have what we call the biopsychosocial model. And so that bio part refers to the anatomy. And the psycho part refers to the psychological component, which can be anything psychological affecting a person. It could be, say, anxiety or depression. And that can definitely affect whether or not a person is going to be responsive to sexual stimuli. And then the social aspect of it, right? So, if a patient has grown up in a sex negative environment, or if they have, like we talked about, the uneven distribution of household chores, or if they have, discord between the partners happening, right? That person is not going to be responsive to any type of sexual stimuli because there's so many other things going on that mentally they're just not ready for that type of intimacy. So, all of that being said, what that means is that those are the things that can affect whether or not a person is going to respond to a sexual stimuli. And that was what we were talking about with responsive desire. Spontaneous desire is when it's like this natural instinct. It's influenced by cultural priorities and gender norms. And it's kind of like what we see on, the media. What we see in movies and read in books is where, those two people are like basically ripping off each other's clothes and all this stuff because it's just, so spontaneous, which actually we'll get into a little bit, because really, even when we think things are spontaneous, they're really not, because you're really planning them ahead of time as to what is going to happen. It's spontaneous desire sometimes also can focus on novelty and mystery. It can, bypass everything and just straight out a person can go ahead and seek out the sexual stimuli and arouse and become aroused. It's often characterized by excitement of newness, mystery, and powerful urge for sexual connection. And a lot of times people can do that within their own relationship, right? So even if you're in a long-term relationship, oftentimes what we see is responsive desire. But you can, through, different types of things that you're thinking about, or perhaps fantasies that you can create that excitement, that newness, that mystery, that urge for sexual connection by trying new things. And again, we'll get into that a little bit later, but after we discuss all these different types of desires. And then, of course, lastly, we have this what's called formative desire, and it involves basically engaging in sexual fantasies as a means of stimulating desire. Fantasizing definitely can be a way to enhance arousal and explore different aspects of your own sexual desires or preferences or that of your partner's. So, when you understand these different types of desires, you can definitely gain insight into your own sexual motivations and better communicate them with your partner, right? So, if you're thinking that, you just have too many things on your plate and you're definitely not interested in intimacy, maybe trying to delegate that to somebody else or sharing those responsibilities with your partner, right? To offload all of those things that you're constantly thinking about so that you can be receptive to some sort of sexual stimuli. And that's why knowing this is so important so that you can communicate and really enhance your own sexuality, but also enhance the spark in your relationship. You also, what's important to remember is that desire is dynamic, right? It changes. It changes as we get older. There is an author, his name is Marty Klein. He wrote a book called Sexual Intelligence. And it talks about how sexuality changes as we get older. And really the intelligence part of it is just recognizing that it happens and that it's normal and that you can definitely change it. You can change what you don't like. You can add things to it. You can subtract things from it. Basically, it's fluid. And so that's why that's so important. The biggest thing is to communicate with your partner. It's also important to create a safe and open space for exploring desire, embracing both the similarities and differences between you and your partner. And definitely various factors, of course, can, augment desire or decrease it. And same thing with arousal, especially in women that may not feel that they have a connection with their partner or that emotional intimacy is lacking. And so if that is happening, then, there's minimal incentives to become involved specifically physically with your partner. And when there's low expectations of the relationship, then there's going to be a decreased want, right? So you're going to only want things if you're not going to want something that you're not getting anything out of, right? So a lot of times I hear women. So there was a woman that I was talking to one time about her relationship, and she said to me, "Oh, when it's time to be intimate with my partner, I just go ahead and do it and just want it to be over with because, it's just not pleasurable for me. And, I just see it as like a wifely duty and I just do it and get it done." Well, that's definitely one way to look at things and one way to do things. But what if, right? What if you were able to get something out of it? What if you actually enjoyed that encounter? What would your life look like? What would your relationship look like if you actually enjoyed what you were doing? Right. And so that's really where I think coaching comes in, because it's a new way of looking at things instead of looking at it as a chore, something that you just don't really enjoy at all. Is there a way to go beyond that? Is there a way to change that? Is there a way to change your thoughts so that even if you start out with sex negativity, you go to a point, maybe it's not sex positive, maybe you just go to sex neutral and that's where you are, and maybe that's where you stay. But even that small shift is going to cause a shift in your relationship. So I think that that is really, really important. And of course, I'm not downplaying anyone that may have experienced trauma or abuse in the past. That is something that has to be dealt with. And a sex therapist is probably going to be the best way for you to kind of unpack all that baggage that you may have so that you can move forward in your relationship. So I think that that is super important. But okay, so various factors. So we talked about a little bit about that biopsychosocial model and just knowing all the things that can affect that relationship and whether or not you're going to be responsive to a sexual stimuli. Other things that can definitely affect whether or not a woman is going to be receptive to sexual stimuli is she experiencing pain in when she has intercourse? Is she able to elicit sensations, right? So as we go through different transitions like perimenopause, menopause, there's decreased blood flow to the pelvic region. So, do you need hormones? For most women, I will say, like, actually, I will say for 100% of women, as they get older through that transition of perimenopause, menopause, they will absolutely need vaginal estrogen. And that's something that I think is so, so important. Whether or not you're sexually active really makes no difference. That vaginal estrogen is good for increased blood flow. It'll prevent recurrent UTIs. It's going to help with your bladder. It's going to help with increasing lubrication. It's going to help to increase sensation in that area. Really, we need estrogen in our vulva, and we need the estrogen also to help with our bladder and to prevent overactive bladder. And I think that, really decreasing that pain as we get older is really one of the key components to staying sexually active, if that's something that you're interested in. And like I said, even if you're not sexually active, it doesn't really matter. This is more about your vulvar health and to prevent those recurrent UTIs. We know that as women get older, they're more susceptible to recurrent UTIs. And we know that a lot of times when women get recurrent UTIs, maybe when they are older, they may not be feeling the signs and symptoms of that. And that can lead to, you know, urosepsis. It can lead to even death. So really it's very, very important to stay on that vaginal estrogen for your whole life. Really, once you hit perimenopause, menopause, I would just stay on it for the rest of your life. There's no downside to it. It doesn't go throughout your whole body. It's really a low dose. It's really for that tissue, that vulvar tissue, that vaginal tissue, that it's so, so important. We also know that sometimes people can have low self-image, right? As we age, all the things start sagging, things are looking different, we're putting on more weight, whatever. Because of all of those things, we can have a low self-image, and that can, of course, affect our relationship. You can also note, remember what I talked about, decreased blood flow to the genitals, so that all of those things can affect it. While past experiences can influence how you feel, right, comfort levels with sexual intimacy, it's really important to remember that you have a choice in how much that affects you. And so I think if anything you walk away with in this part of the podcast is that you really have a choice of what you want your relationship to look like. And oftentimes, what I tell patients to do is imagine what their ideal relationship would look like, right? And then work backwards from there and to see what you can do because we can't control others. All we can do is control ourselves. So, what would it take for you to get to that point in your relationship where you have that ideal relationship? And what do you need to do to get there? So, I think that those are really important questions to think about in any relationship. And it's so important to remember that your mindset plays such a crucial role in shaping your relationship and your experiences and really reigniting that spark in your relationship with a growth mindset so that you can overcome any type of barriers that you may have experienced in the past and create really a fulfilling and pleasurable relationship that you look forward to at the end of the day, or that someone who that you look forward to seeing at the end of your day, right? You really want to foster that relationship. You want to create that emotional intimacy. And the next podcast will get into how to create that and how to enhance intimacy and communication in your relationship. But really think about, I want you to start thinking about ways that you can increase intimacy in your relationship and what that would look like. And it's not as hard as you think it might be. So, well, that is it. And it's been real and really intimate. And stay tuned for the next few episodes because I am going to get into what we can do to increase that spark in our relationship and how to foster communication. So stay with me. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.